Hi, I'm Steve Adubato. You can see that we are recording remotely, and we are honored to be joined by Dr. Richard Besser, President and CEO, Robert Wood Johnson Foundation, also former acting director of the Centers for Disease Control and Prevention. Dr. Besser, good to have you with us.
It's great to be here, Steve. Thank you.
I told you right before we got on the air and taping that I've been watching you along with millions of others on CNN, trying to give accurate, scientific, medical, important information. How challenging is it to give that kind of information consistently about COVID-19 in this highly politicized environment?
Yeah, Steve, I think one of the biggest challenges in this pandemic, and something that we tried to avoid in every public health crisis I was involved in at CDC, is how political this has gotten. We're seeing a clash of messages where every public health leader in the nation is calling on people to take action because this is serious, it's early, it's dangerous, and what we do matters. And then on the political side, we're seeing messages all over the board. Some politicians from both parties saying, follow public health, it's the way to go. And then others saying there's nothing to worry about. And when that happens, it becomes very difficult to really push forward public health messages because they're viewed as political instead of fact-based and science-based.
So a couple of things here. First of all, let me disclose that the Robert Wood Johnson Foundation, based in Princeton, New Jersey, correct, Doctor?
Yeah.
We are one of the grant recipients of dollars to, in fact, do public awareness programming around critically important health issues in New Jersey and the surrounding areas. So here's really where I want to go with this, is from a public policy point of view, Dr. Besser. For those who say, let the states decide, let the counties within the states decide, let the municipalities within the counties within the state decide what is the best public health policy as opposed to, quote, a national policy, because New Jersey and New York, not Arizona, or really, we are not Arizona, we are not Florida, we're not California. What is the best approach from a public policy point of view, and at what level of government?
Yeah, when you think about a pandemic and what it means, when you have a new disease that's spreading around the world, what you see is it's not hitting every place at the same time with the same ferocity. We were hit in our area early on. We were hit the hardest in the nation, and we've turned it around. The numbers are moving in the right direction in this area. But what you need to see is that every area is playing off of the same playbook. So if you're an area that's getting hit hard, regardless of where you are, you're approaching it the same way. And what we found, in terms of public health tools, staying at home orders is a way to slow this down. Extremely painful, especially for the lowest income Americans, but that's what it takes to slow this down. And then when it's slowed down, then you respond locally based on what's going on, but off of the same playbook. I heard someone describe it as, if it's raining in Maine, that doesn't mean you have to put your umbrella up in New Jersey. But if it's raining in New Jersey, you should be taking the same response as Maine, and you should put your umbrella up. And what we're seeing is many parts of the country, it is not just raining, it is pouring, and people are not doing what needs to be done to get this under control.
Let's also clarify that we are taping, unlike our brothers and sisters on the PBS broadcasting side in the New York, New Jersey region. If you want to look for day-to-day news, you can see NJTV News, you can see Metro Focus, out of WNET in New York, our public broadcasting partners. We look at things, we try to look at things with a longer term view, if you will. So the risk is, Dr. Besser was just saying, and we're taping on the 13th of July, you'll see on the screen, you'll see the information there. We never try to hide that. Dr. Besser said, as we speak today, things are better in New York and New Jersey. What do you think we need to do, Dr. Besser? Let me put it this way. Can we in New Jersey, my wife was just saying this morning, look at the numbers. They're down in New York. They're down in New Jersey. We're doing better on the 13th of July. Can we lock ourselves off from the rest of the nation with many states having so serious problems?
Yeah, I mean, that's one of the big challenges, Steve, is that, viruses don't respect borders. And, although this region has said people coming from other states need to quarantine, that's basically a suggestion, not something that's truly enforceable. And so it's extremely important that we're diligent, that we don't get complacent, that we're collecting the data that's necessary down to the zip code level to ensure that, as there are new cases and new clusters of cases in New Jersey, because there will be, across the whole region, until this outbreak is truly over, we're going to see clusters and outbreaks. So you need to be collecting data, and you need to be able to respond quickly with a true public health model, which is early case identification. So making sure that there's testing available everywhere with rapid turnaround. You need to be able to get those test results within 2 days if you want to be able to act on those. And then you identify every person that the infected person has had contact with, and you ensure that those people can be quarantined so that if they get sick, they're not going to infect other people. Those steps take a lot of effort by public health. They take dollars, and they take a lot of dollars that states don't have. So they take federal support to ensure that not just people of means have the ability to stay home and be safe, but every citizen in our country has the ability to safely isolate or quarantine, get the income support, get the support for childcare or elder care. These things are really, really important. And to date, we haven't provided the services, the wraparound support to show that we value every life the same.
Along these lines, Dr. Besser, we know from our interaction with the foundation that one of the major missions is to build a, quote, culture of health. Let's talk about the disproportionate impact of COVID-19 on people who are struggling economically and who are Black and brown. Not only why is that the case, I mean, we can talk about social determinants of health, we've done that before here, but is there a real policy to deal with those disparities, particularly as we're supposed to be more sensitive and aware of the structural injustice and institutional racism that's been in a part of our country for so long, playing out in COVID-19?
Yeah, I mean, the demonstrations that are going on around the country around, anti-Black police violence, structural racism in America, link directly to what we're seeing in COVID. When you look at the disparate impact where Black Americans, Latino Americans, Native Americans are getting infected, are being hospitalized and dying at rates 2, 3, 4 times the rates of white Americans, that should be unacceptable. And yes, some of it has to do with differences in underlying medical conditions, again, which can be traced in large part to structural racism. But a lot has to do with the proportion of individuals who are essential workers. And we throw that term around all the time, essential worker. But before this crisis, when you talked about essential workers, people working in food service, people working in food production and transportation and childcare and family care and, frontline health workers, a lot of these essential workers were not even being paid a living wage.
That's right.
So, here we are in a situation where people who are essential workers are going to work, not having the protective equipment necessary to ensure that the chance of being infected are reduced as much as possible. And then when they're getting infected, they're not being provided with the support they need to ensure they're not spreading this within their households. Black Americans, Latino Americans, much more likely to live in households that are multi-generational, much more likely to live in households where there are people with underlying medical conditions. So as a society, we have to say, okay, what services are needed to ensure that someone who's infected isn't going to spread it to their family and their community? What do we need to do to ensure that somebody doesn't have to make this incredibly grueling decision between, do I go to work so that I can put food on the table and pay the rent so I don't get evicted? Or do I stay home and so that I'm not going to potentially spread an infection in the community? No one should have to make that choice. But in America today, we're not providing the services and support that so many other countries around the world are providing that have been able to get this under control.
Steve Adubato here, Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation, former acting director of the Centers for Disease Control and Prevention. A couple more minutes. The foundation has a $50 million COVID-19 health emergency fund. What is that? And I also know, because we're based in the Garden State, a specific amount, I believe it's $5 million, directed to New Jersey. For what? Impacting whom?
Yeah, this is something that's unusual for us as a philanthropy. We're the largest health philanthropy in America, but we rarely focus on direct humanitarian support. We're looking at long-term policy change and programs to really change society in a way that everyone has an opportunity for health and well-being. But the nature of this crisis was so severe that we quickly stood up and said, we're going to put out $50 million to address several needs around food, needs around housing, and needs around income support. And
Right.
we were targeting those people in America who were struggling the most. So domestic workers, low-income individuals and communities, immigrants, people who were not being covered directly by a lot of the legislation and support coming down from the federal government. $5 million of this we earmarked for New Jersey because we have a special relationship in our state.
Right.
We are the largest philanthropy in New Jersey, and we spend the most philanthropic dollars in the state. But the $5 million have been spread out across the state, a lot of the money being distributed by community-based foundations that are in best position to understand the local needs. But a lot of this is around the basic supports of food, of housing. We're in a situation in America where there are millions of people who are very close to being evicted. Federal supports and bans on eviction are expiring, and people are facing large amounts of back rent. That shouldn't be. In a situation of a pandemic where you want people to have safe, secure housing, so if they are exposed, if they are infected, they have a safe place to be. We are going to be seeing millions of people who are at risk of being homeless.
Final words on my end. Recently, some in the White House, we're not sure whom, and we're not a political program, said that sometimes Dr. Fauci engages in doom and gloom. He's Dr. Doom and Gloom. And I'm going to say this. I don't know what one would call it, but what you just heard from Dr. Besser are cold, hard, meaningful, important, relevant, critical, scientific, medical, clinical facts. There's no way to color them. And so on that note, I just want to thank you, Dr. Besser, for joining us and continuing to help us in public broadcasting, help our audience better understand what they need to understand to make critically important choices, not just for themselves and for their families, but the communities in which we live. Thank you, Dr. Besser.
Thank you, Steve. It's a pleasure being here. And I just want to say that public health science, public health guidance is the roadmap to sustained economic recovery. It's not the enemy. And together we can pull together and make this happen.
Yeah. Finally, people who try to say, is it economic or is it public health? As Dr. Besser said, again, not my job to do commentary, but separating the two seems counterintuitive. Thank you, Dr. Besser.
Thanks so much.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by RWJ Barnabas Health, New Jersey Institute of Technology, the Healthcare Foundation of New Jersey, PSC&G, the New Jersey Education Association, Valley Bank, the New Jersey Economic Development Authority, Johnson & Johnson, and by United Airlines. Promotional support provided by New Jersey Monthly and by ROINJ.